I think what makes me passionate about this work is just the impact that the Y has on kids and families. And over this last year, the opportunity to really support families in a lot of new ways. Just really meeting families where they were in the community, a place where families felt safe coming and wanted to have their children involved in activities.
When everything shut down in March of 2020, we knew that there was still going to be a really high need for childcare. And for anyone who's done YMCA childcare programs, we love what we do. We're passionate about making sure that kids have a safe space to be. And so when everyone else was shutting down, we actually opened our doors back up and we provided emergency childcare for medical personnel and first responders so that they could continue to go to work and do the important work of caring for our communities and caring for our society.
We've definitely had every curveball thrown at us. For our programming, for our fitness centers, for our child care program, our school age programs, you name it. There was a curveball given to us, but we have persevered. We see ourselves coming out of that. Our services continue to be at a high need, and we were able to continue to offer those services at a high level. I think our organization did a great job of adjusting to the challenges that were presented to us.
My program is not typically something that offers all day care every day of the year, but when the pandemic started, we did.
That allowed us to open our doors to our community who had possibly never been in our programs before. We provided care to people who had never stepped foot in our doors, who didn't even know that the Y had a child development center, but they entrusted us with their children without even coming into the building, and I think that's a lot of because of what the YMCA stands for. They knew their children would be safe. They knew the quality of standards were high. And so for those 8 weeks, we were able to cater specifically to essential workers and have been able to keep some of those families with us beyond that time and have continued providing care. And I think during that time, we really saw the high need for our service that we provide, and even in the midst of the pandemic at its peak, we were still able to provide care for those that needed it.
The Y has really kind of been that throughout our history, but I just think the Family Resource Center model, what makes it so special is the way we bring about partners so that families have access to all of the services. The Y is already a place where they feel safe and want to be, but there's no social stigma attached to all of these other services that they may need, whether that's help with food access or mental health access, any of the other services that they might need from the state that they can access. So the Community Hope Center model that we've been working in for the last year has really been tremendous in really helping families access all of those other supports that they needed during that time.
We are definitely continuing to grow our partnerships and we're looking at other agencies that we can work with to address mental health needs. We know that this last year has been really difficult for a lot of people, and so we're trying to find ways that we can both encourage our staff and also our participants and members to look at the whole body. As I said, we're all about healthy spirit, mind, and body. So the ways that we focus on our healthy bodies, we've been doing that for a long time, over 130 years here in Oklahoma City. And so now we're moving into how do we help people grow and have healthy mental health and to be the best that they can be in all areas of life.
Well, we are very honored that the Oklahoma Turning Point Council would recognize our efforts in this way, and we're excited to accept this honor on behalf of all of our partners. We could not have done everything that we did in the last year without all of our community partners, whether the United Way, Oklahoma State Department of Education, Oklahoma Department of Human Services, the Regional Food Bank, all of our local public school districts, the City County Health Department, all of them rallied together to meet a lot of different needs in a lot of different ways. And that's really what defines a Family Resource Center. It's bringing all of those resources together to better meet the needs of the families. And the Y was happy to be a partner in that and delivering those services.
On behalf of the Oklahoma Turning Point Council, we name you as a community health champion, and thank you for all the work that you do.
Thank you.
Thank you.